Great. Thank you. I'd like to welcome everybody to the Board of Health meeting for Ashland, Massachusetts, September 19th, 2023. Just a quick statement. This agenda is subject to change and includes those items reasonably anticipated by the chair to be discussed at the meeting. Not all agenda items may in fact be discussed, and other items not listed may also be brought up for discussion to the extent permitted by law. Call the meeting to order at 6:06. First order of business or second order of business then is citizens participation. Anybody here for that? No, just us. Okay, then we can get on to agenda item 3, which is Marathon Mobil Retail. The new owners are asking for a waiver from the tobacco regulations, section E11. Do you want to take this, Raj?
So,
I'm sure. Yeah.
Thank you. And we have Allison from Marathon Mobil. So I guess what has happened, like, they are looking for a transfer of a tobacco permit. They are actually the owners of that property now. Earlier, they have rented it out, or I guess, they bought it in 2021, to my understanding. And there was a tenant they have, or earlier Mr. Muhammad, I guess, who owns the store part of it, he had a waiver from the board, given its proximity to the middle school to have the tobacco permit, So right now it's just a transfer that they're doing from them to the owner themselves, so they'll be operating the whole thing, the gas station, the store, as well as the repair shop, so they are just here for that extension of the waiver that was granted maybe a couple of years back. So, Allison, if you wanna put something, or if you wanna say something.
Okay. So, Diane, I know you're here probably for this. Yeah, I know you want to say something. So why don't you tell us what you think?
Well, I mean, I'm on the meeting for Marathon Mobil just to show support for local business, and I know that being on the board has given the waiver in the past, but I just thought I'd be here for support. Friends with Allison and her husband Anthony, but I think they'll run a successful business there, and I don't think the board will have any problems with tobacco products being sold to minors, even though the close proximity of the school.
Yeah, well, correct. I know when we were, when Chris, redid the regulations, they weren't meant to decrease the value of the business, and they had already been, grandfathered in way before those regulations were newer regulations were written. So at least that's as far as I remember. Any other board members have anything to say? Jay, Barbara, Ed?
So I do. Allison, I don't know if Allison and Anthony are also on. I also want to support them. I know they're going to be great. They're going to be great. They've already great business owners on the vehicle maintenance side. But I just want to make sure, and I know they're going to do this, but just they're probably going to hire hopefully some youth in our community too that are probably going to be working at the store. I just want to make sure that you guys make sure that they are properly trained and that they're carding everybody so that you don't end up with a fine in front of the board later on. Because I probably know you're going to hire people in the community.
Allison, or do you have anything to say, or looks like you want to say something?
We actually can't hear you, so I
can't hear you.
How about now?
Can you guys hear us now?
Yeah.
Yes.
Okay, sorry about that.
Yes.
So we're Anthony and Allison Fiorenzi. We are the new owners. We took over about 2 years, just over 2 years ago. So it was leased. The store was leased out before. Their lease is due to expire the end of October. We're just looking to
take over the whole thing.
Yeah, take over everything and keep it as is. Basically, go about everything how we should. So we're just looking to keep the business going as is.
Yeah.
And absolutely
No,
training.
I'm sure.
The
Yeah, I'm sure you'll do a
employees
great job, and Raj is there for any any training materials or advice that you might need, for probably the young kids. That's typically what we see, unfortunately.
Yes.
A high school kid unfortunately sometimes doesn't card somebody. That seems to be the most consistent way that underage kids get cigarettes. So just a shame, because the fines are pretty stiff now. We don't control those. That state controlled, and they start at $1,000. So we hate to see any business have to suffer that, especially now. It's not like you're a big corporate thing, you're your own entity. So Barbara, I think you have something to say.
No, I'm just
okay. I thought your muting was off. And yeah.
No.
Okay. Jay and Dave, anything?
I guess not. I mean, I didn't see anything in the regulations stating that that this couldn't be done with the transfer to a new owner. And that's what I was looking for, because I wasn't an author on the original. Yeah. I wasn't part of the original regulations as they were written up.
Right.
So nothing jumped out at me, and I thought that maybe something would come out in this meeting. But I mean, it sounds like there seems to be support. So if I'm hearing that correctly, so
yeah. Dave?
No, I'm good. I mean, obviously, the regulation is there to just make sure that there aren't any transgressions around the sale of tobacco products to minors. So as long as that is the way this goes, then I'll be happy.
Okay. All right. Anybody like to make a motion to grant that waiver?
So I have to just pull it up.
Nobody? Ed?
Yeah, I'll make a motion that we grant the waiver to transfer the tobacco license to Marathon Mobil to Allison and Anthony Fiorenzi.
Okay. Any
Second
seconds?
Yeah.
Okay, that's great. All in favor? Aye.
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 All right. Yep. Looks like that passes 5-0. Right. Well, congratulations with the business, and best of luck with everything there.
Thank you. Thank you all for your support. We really appreciate it.
Really appreciate the support.
Yeah. Yeah, of course. Thanks, Di. Want to stick around just to reminisce for old times, or you think you got better things to do?
I think I'll stay on and listen for a while.
Okay, well, that's good, because you get to hear Raj talk, because he's up next with the health director's agenda. Go ahead, Raj.
Thank you, Dr. Ron. First on the housing case is Chestnut Place Apartments. The roads thing is still going on. We picked up a new case there, 14 Joint Drive number 7. I was out there Thursday to do inspection. That apartment have activity. The apartment that was there before the board, 14 Joint Drive number 6. I did a re-inspection there, still have activity. So still going on, I'm addressing with the management. Only good thing is their dumpster area is very clean. I did inspect that also, so keep the board posted on that. 137 Pond Street, I did had a phone conversation with the AG's office, and they'll be sending the owners a 2 weeks letter stating, that they want to respond within 2 weeks, or they're gonna do further enforcement, or or probably bring it to court. So, and they'll be sending me a copy of the letter that they'll be sending it to the owners. I'll forward to the board, once I receive that. So this is where we are at with 137. I did an inspection back at Mill Pond also, at the same number, room 5. I didn't find any live bed bugs, but I did find 7-8 of the dead ones in the traps, so, and did talk to the occupant there. She was kind of happy, like she have not seen any activity, but given how the dead ones was there, and I guess Friday the pest control company was back after 2 weeks. Their report also said that there was activity in room 5. I know the report that came to the board, didn't have that number 5 room in it, but I have to call the management, to get that rectified. And there was not also, the date was not also there, Dr. J mentioned that, so I will forward the new report to the board, so there's still activity there, but hopefully resolved, And other than that, the restaurants, there are a couple of restaurants that changing ownership. One is Marathon Mobil. They have a retail permit from us, and the other one is Dairy Queen, that's changing hands. To my knowledge, our beaches are still posted. This week I didn't get a report, but as for last 2 weeks, the beaches were still posted. With the Arbovirus, first West Nile virus, so far in the state, we have 131 West Nile positive water samples and 3 cases. But with Tripoli, now we have 12 water samples. That is a little concerning to me. Looks like we might have another maybe 3 weeks, before the first hard frost, so hopefully don't see any cases, on the Tripoli front. But for right now, we don't have any in the state. We finally got, compliance with the abandoned pool on Cedar Street. I did last inspection a week and a half back. It was all cleaned up, water drain, but I'm still gonna keep an eye on the pool. With the landfill, we have signed the contract with landfill. It's all executed, they should be out this week probably, or early next week to do the monitoring, because we're almost end of September and our report is due now. Like end of September, the report is due to be submitted to the DEP. With the flu clinics, we already did 2 clinics for the flu with the Pine Hill Pharmacy. We have 5 more lined up as of now. The next one is October 10th for the flu. And additionally, as I sent an email to the board today, we got 40 flu doses, from the state. That is for under 19 and uninsured people. So that will be doing some doses tomorrow with our childhood vaccine clinic. And if anybody needs, under 19 flu dose, or, if it is somebody's uninsured, these doses are just allotted to under 19 and uninsured people. So we will be happy to accommodate that. Other than that, another COVID booster is approved now, authorized from both FDA, CDC. If it comes out, readily available before the October 10th clinic, we're going to probably do a COVID clinic with the flu. It's approved for 6 months plus, so for anybody who is over 6 months can get a booster dose. Last item, disease investigations. This month we have dealt with 4 different cases. There was 2 cases of babesiosis. There was 1 case of typhoid fever, Salmonella typhi, and there is 1 case of giardiasis that we are currently dealing. The kid is in our elementary school and he's out of school because of that. Both the Salmonella typhi as well as giardiasis is both foreign travel cases, so we're not concerned. The babesiosis was local cases, but they are both tick-borne. And I guess I'm open for any questions now.
I have a question for you, Raj, or a comment. So regarding vaccines, the Latino Health Insurance Program, which is the organization that was doing the follow-up for the RAM clinic, Dr. Milagros Abreu runs it. She was asking me, and I'm looking at a text right now, if the Board of Health or the town of Ashland would be interested in, initially the term she used was collaborating, and when I asked to have her elaborate on that, collaborate on vaccines. I think what she meant was make referrals, and her communication to me was that the LHIP can support events or receive any referrals for anyone needing free COVID-19, flu, or child vaccines via walk-in service Mondays through Fridays. And so I told her that I would bring it to the board and to your attention that if we had anybody that for whatever reason we couldn't service, that maybe we'd be able to refer them over to LHIP.
Absolutely, sir.
Yeah,
and thank you. Please go ahead. Go ahead. Sorry about that.
No, just wanted to say I'm happy that Ed Berman's here, because I don't know if he has any thoughts about that too, but just wanted to get your thoughts on that.
Yeah, and then Raj, if we don't use those 40 doses, maybe we could call Milagros and transfer them before they expire. Just in the event we don't use all 40, that way next year we'll get the same amount again.
Absolutely, Mr. Berman. I mean, we plan to use and get more. That's the plan for right now. But like we had a little thing with the Latino Health when we was trying to give them the DTaP, and they refused it straightforwardly. So
yeah, that's because they had so much of it.
Right. But like Dr. J will be happy to collaborate. I mean, that's a great thing. If we have anything we cannot service, or any more kids, we'll definitely do that. So why we can do this if you want to put me in touch with Dr. Milagros,
yeah,
and we'll go from there. And we have 2 public health nurses, right now, Jessica and Ms. Prolander, so we can do that, and we can coordinate that. But that's a good news, any collaboration for vaccines, we are here to vaccinate more and more kids, that are out of school. So that'll be helpful.
Do you want me to set up a meeting with you, or just put you in touch by email?
No, we can do a Zoom meeting if you're available,
Yep.
Yes, that'll be helpful, so we can do it on Zoom, in person. I'm comfortable either way, so.
Okay.
And I'll see if Jess and Kate is available too, so they can be on the meeting, but please put something together. We'll definitely love to talk about that.
Yeah, that would be great. And Ed, would you want to be invited to that, whether or not you could make it? I can invite you.
Yeah, that'd be great.
Okay. And so I'll do that. And then Raj, if you want to just then send in any invitation that comes out to Jess, and anybody else, feel free to do that.
I will do so, sir. Yes.
Okay. Okay. Very good.
Okay. That's great. Anybody else? No? Okay. Can move on to the consent agenda, which is to review and approve the Board of Health meeting draft minutes for September 5th, 2023 and fiscal year 2024 year-to-date budget report. Anybody have any questions on those? No?
Nope.
Okay. Anybody want to make a motion to approve the consent agenda as written?
Yep, I'll make the motion. Motion to approve the consent agenda as written.
Okay, great. Any seconds?
Second.
Second. Okay, thanks, Dave. All in favor? Aye.
Aye.
Good. Okay. Looks like that passes 5-0. Thank you. And item 6, any future, items that anybody wants to talk about next meeting, which I'm assuming is what it's going to be. Let's see, what, October 3rd. So it means we must be the 3rd and the 17th next month, which is exactly what that says. And anything pressing?
I've got something
No.
maybe that could be on the next agenda, or maybe the meeting after that. It involves Ed Berman. Ed, I don't know if you've had a chance to talk to Keefe Tech about how things went with the RAM clinic, but of course what I'm getting at is, would they be willing to do it again? And maybe we could discuss that here, not with them, but you know, the board. Do you have any plans?
I have a board meeting coming up the first week in October, so I could I can bring it up, and I'm sure they would say okay.
Okay, so maybe after that, then we'll discuss it here, Ron.
Yeah, I think the next meeting,
whenever you want.
Let me just hold on. The next meeting for the board is, let me pull it up for you, October 2nd.
Okay. Very good.
So we can tentatively put it on for the 3rd, and if you don't have anything, we'll have it on for the 17th.
Perfect.
We'll just keep it on. So if you have any info, great, and if you don't, that's fine.
Perfect.
Okay.
Is there do we have a meeting on the 3rd?
Laura knows all. She'll put it on.
Dr. Joe,
Yeah,
Jay, go ahead, please.
That's correct, Laura. We have a meeting on the 3rd. For some reason, I thought it was the second Tuesday of.
1st and 3rd.
It's been like that for years, and I still can't get it. Okay.
That's okay.
Sounds good.
Yeah. Okay.
All right.
All right. Anybody have anything else, Barbara?
Well, just like you're just talking about seeing if we can get the RAM. I don't know how everybody thinks about this, because I know with my other group with area, you know, we've been trying to help you know, the few families that are in Framingham, you know, that are homeless with, you know, like simple stuff like clothing, like day-to-day stuff. And I know we have them in most towns around us. So I just wanted to make a comment, like if we get the RAM coming around, because I know I went to see them last Friday, and I know right now the state is helping them, like even with the vaccinations, because I know we had talked about that with Raj. The state is helping that, but you know, just to keep in mind, because they're all around us. Marlborough, Framingham, Northborough. I don't think we have any families in Ashland yet. But just to keep in mind, because if, you know, they need the support.
Yeah. And as far as RAM goes, the services that they offer, you know, these folks would need to show up at the clinic, of course. But the next time we're going to be able to do this would be August of next year. So it would be a yearly thing.
Yeah.
Not any more frequent than that.
Yeah.
Now that having said that, there are several free medical clinics. There's Gratis Healthcare. There's the Edward M. Kennedy Center.
Okay.
There's the Metro West Free Medical Clinic. And then, of course, there's the Latino Health Insurance Program. And those are just the ones that I know of.
Yeah.
And there may be more. I would definitely refer people to those organizations.
Okay.
Yeah.
That's
very helpful.
Barbara, I just want to add for the vaccinations, you know, we can accommodate as many people as, you know, if anybody, you know, working with them in Framingham. I am aware that we got a couple of families already that I was in that clinic that we vaccinated, you know, part of that group, you know, but like if you have any contact there, you know, with the vaccinations, I will definitely take care. Only other thing that we have available right now is free appointments, you know, for physicals. If any of the kids need free physical, I have the vouchers that I'm happy to give it to you, or, you know, the families, you know, it's with Convenient MD. Yeah, there's a pharmacy. They have a location in Framingham as well, you know, so I can provide as many coupons or vouchers as anybody needs for free physicals, you know, if that can be a requirement.
Okay, thank you.
Absolutely.
Yeah.
That's great.
Thank you.
Raj.
Information that was helpful.
Sure, thanks.
Okay. Anybody else with anything? Nope. Okay. Anybody like to make the motion to adjourn?
I'll
I'll
do
make
it.
a motion that we adjourn.
Okay.
Barbara and I are
All right.
always in
That was a
unison.
tie between Barbara
Barbara and I
Ed.
are always in
Okay,
unison.
That means neither of you can second it. Any second from Jay or Dave?
I'll second.
No? Okay. All right. Di, did you want to say one last thing since you're on?
I just want to say good to see everybody, but I also saw the statistics on the RAM clinic, and I just wanted to comment, great job to the board for doing it. I appreciated, I wasn't able to be there myself, but I appreciated seeing the information about it, and good job.
Yeah, thanks, Diane.
Yeah, that's really, Jay and Ed and, Barbara was there both days, and Raj was flying around all, both of those days too. So, it was really those two guys, and some of the other members you really brought in to help. I can't believe you're going to torture yourself again and do this again next year, but
Ron, you were there too. Again. You played a big role too.
Yeah,
and I'm glad that
I didn't do what you did.
I'm glad you were able to get in with that they checked the license and all that at the last, the 11th hour. So
yeah, that was Ron. Yeah, I think he just trusted me. Yeah.
Oh, really? Hey, whatever works.
I showed him a card. I don't think he would have just figured. So
yeah.
He said, we can use all the help we can get.
Yeah, that's good.
Yeah. So anyway, all right. Well, Di, thanks for coming on and showing your support, to the new owners for sure, and thanks for all your previous help with the board and the tobacco regulations in particular.
Good to see everybody.
Thank you.
Have a good night.
Yeah.
You too.
Yeah. Thank you.
Good to see you.
All right. So so we'll have to second that motion, and everybody did. All in favor?
Aye.
Aye. Okay. I think we did that in case we didn't. All right. That passes. Good to see everybody. And we'll see you in a couple of weeks. Raj, I'll talk to you.
Good night.
Okay.
Sure. Thank you, Dr. Ron.
Okay.
Thank you, everybody.
Bye, Laura.
Good night.
Thank you.
Okay. Good night. Bye.